Welcome to this important discussion by James and Liam on the hazardous side effects of abusing steroids and performance-enhancing drugs. While some athletes may be tempted to use these substances in an attempt to gain an edge, the risks involved are severe and potentially life-threatening. Let's delve into the disturbing realities. Side effects in men.
For male users, steroid abuse can inflict catastrophic damage upon the male reproductive system. Common side effects include testicular atrophy, leading to shrunken testicles, as well as diminished sperm production and fertility issues. The disruption of hormonal balances can also trigger the development of gynecomastia, an abnormal condition causing male breast tissue growth. Erectile dysfunction is also another unfortunate consequence.
Beyond impairing masculinity and fertility, these drugs heavily tax vital organs. Potential impacts include an enlarged prostate gland and heightened risk of prostate cancer, severe acne, male baldness, liver inflammation, which can progress to liver failure, as well as kidney stones and impaired kidney function.
Perhaps most alarmingly, steroid use strains the cardiovascular system tremendously by raising blood pressure levels, increasing cholesterol, and causing a thickening of the heart muscle, all of which elevate the risks of a heart attack and stroke.
Effects in women. The dangers for female users are equally as disturbing. A condition can arise, causing women to develop masculine traits such as a deepened voice, excessive bodily hair growth, and permanent pattern baldness. Menstrual irregularities frequently occur, along with struggles conceiving and an elevated risk of miscarriage if pregnancy is achieved. Severe, disfiguring acne, as well as psychiatric issues like depression and body dysmorphia disorder also are potential outcomes.
Critically, research has demonstrated links between steroid use in women and greater chances of developing breast cancer and life-threatening liver disease. The long-term impacts can be devastating. Mental health risks. In addition to the litany of physical repercussions, steroid abuse has been shown to precipitate severe mental health crises as well. Users frequently experience roid rage, an abnormal condition marked by explosive outbursts of violence, aggression, hostility, and
uncontrollable anger. These substances can foster psychological addictions, with users experiencing distressing withdrawal symptoms upon attempting to discontinue use. Perhaps most concerning, there is a well-established correlation between steroid abuse and elevated risks of depression and suicidal ideas, particularly during withdrawal periods. With the plethora of hazards we've outlined, ranging from compromised reproductive health to potentially fatal organ damage and mental health crises, these clearly illustrate that the abuse of steroids and performance-enhancing drugs is an unsafe practice with ramifications that can persist for a lifetime.
Education and prevention are crucial to protecting our communities. I urge you all to make wise choices.
Another thing to mention is how we got our information. What me and Liam did was we searched online on Google negative side effects of steroid abuse, and the first link that popped up was Mayo Clinic, and I've used Mayo Clinic before. It seemed to be a pretty reputable source, but I clicked on it. I copied and pasted the link, and I also went to Wikipedia to check if it was a reliable source after putting the link in. And it said it was reliable. It said that there was a lot of trusted doctors and scientists backing a lot of the information, and it was a pretty popular website for getting health and wellness information from, so I felt pretty confident when getting my source from there. Thank you for listening to our Health and Wellness podcast.